Good evening, everyone, and welcome to the call. This is WellMed, and my name is Lorraine Buell, and I'm an independent distributor for WellMed Global Products. Our focus today is WellMed's Vaginal Rejuvenation System, a revolutionary product that addresses a problem that impacts increasing numbers of women around the world. We hope you'll enjoy our conversation today as you hear stories from people who have used the product and from those who can give you an understanding as to how the product works and why it's so important for the health and well-being of women. We'll also have some questions and answers that have come in from women like you. One question that might be on your mind is, will this work for me? Maybe you've been dealing with this situation of vaginal dryness for a long time. Maybe you've even given up hope of ever finding an answer. On a personal level, VRS was more than what I thought it would possibly be. In fact, it was VRS that convinced me I wanted to be part of WellMed Global. Since I was reluctant to use hormone replacement therapy, I was faced with dim hopes of ever being able to enjoy intimacy with my husband again because things just got too painful to endure. From my first tube of VRS, I knew this was different. First, I felt comfortable because it's a natural product and it contains no hormones. Second is that it was very easy to use, but more importantly, it worked better than anything I've ever tried. In just a few minutes, we're going to have some folks come on the call and share their VRS stories. But before I bring them on, it's my pleasure to introduce you to WellMed Global's president, Ms. Tina Johnson. Tina, many people have learned to trust WellMed's reputation for quality. Can you tell us what makes this company so special?
Thank you, first of all, so much for hosting this call. This is truly an important topic, and it's not called the silent condition for anything else other than women will not talk about it, and they won't talk about it with their doctors. You know, these products and our products are so special because we have the highest integrity. We have science behind our products. We have proven products that work because they're tissue specific. And what I mean by that is that the growth factor technology that is in the VRS, the Vaginal Rejuvenation System, is like a laser beam that hones in on the vaginal tissues to do the healing and repair, the rejuvenation. And because Dr. AQ was approached by many women, it was the reason why he brought this product out. I had the good fortune to be with him and listen to him in Atlanta, and a couple of things that he brought up that I thought were so incredibly powerful. You know, we asked him a personal question. Why didn't you go into practicing as a doctor? And he said, you know, if I practice as a doctor, I'm in a system. What I'm here to do is affect change globally. And so what I had to do is I had to think outside of the box. I had to think about where does our system lack and fail, and what can I do to complement that system? So when he had women coming to him and talking to them about the silent condition, painful relations, even just pain, burning, itching, and dryness, which is the silent condition, it was like profound to him that when he talked to his fellow doctors, he could not get them to say that there was any kind of a cure for that. So his mind went to work, and he said, you know, I know how to work with growth factor technology to activate dormant stem cells to heal and repair tissue. Why don't I work with the VRS? So he came up with the VRS because so many women in their 20s today, 30s and beyond, are experiencing the silent condition. And it affects millions of women, not just a few here and there. And that's why there are so many wonderful women on this call tonight, because we need to talk about it. We need to get this out there, and we need to be able to feel comfortable talking about this so that this can no longer be the silent condition. One other thing that I thought was very powerful I'd like to share with you is that when we were talking to Dr. AQ, he mentioned that birth control pills back in the 60s and 70s, when they became so popular, doctors were prescribing birth control pills. here and there and everywhere. And even our young girls today, if they go in and they have PMS issues, the first thing that the doctor is going to try to do is give some kind of a birth control pill, a contraceptive, to try to help with that PMS. And it was interesting because now the studies are showing that it actually accelerated the dry vaginal syndrome. So we're seeing a wave right now of women in their 50s, 60s, 70s that are really experiencing this dry vaginal syndrome. And a lot of it has to do with the birth control pills that were given in their early years. So when we look at this, it's so important to us at WellMed Global because we want to help women's health. Yes, we have great products for anti-aging, but when we look at what our crusade is here, it's about having high technology products, superior quality, and bringing those out into the world. We aren't going to have Me Too products. And so, Lorraine, when you mentioned that it was the VRS that really attracted you to WellMed Global, I'm finding that a lot of people are now saying, wow, this is an amazing product. So we are going to do a better job here of getting you more materials and having calls like this so that we can have a platform for women to come out and talk. So, Lorraine, I want to give it back to you and thank everyone for being on tonight's call.
Thank you, Tina. And, I've been to a number of the talks that Dr. AQ has given, and over and over again, every time he speaks, I just get a deeper and deeper and deeper appreciation for what we really have. Well, I have a few guests on the call today, and my first guest is Darlene de la Plata, and she is very much involved in a holistic approach to wellness. And Darlene, what prompted you to decide to give VRS a try?
I decided to use the VRS after hearing the multitude of women from each event that I would go to talk about the things that they had experienced. And I'm 53 years old. I'm a grandmother. And, I wasn't experiencing a lot of issues, but there were a few that were kind of concerning to me. And so I thought, well, in April, I had been on the StemFit since October. I decided to add the VRS and see what my results would be. Probably the first thing I noticed after the first tube, which to me was remarkable, the muscular integrity of the walls completely changed, and it was very noticeable. It changed the sexual response. It changed. The most surprising thing for me was that it had been an ongoing problem, especially for the last couple of years, that if I would laugh hard, cough hard, sneeze hard, I was always wetting my pants. And, in my house, you have to either go up a flight of stairs to make it to the bathroom or down a flight of stairs into the basement to make it to the bathroom. And it was just never enough time. And so my daughters and I kind of had this little joke, don't make mom laugh, she's going to pee her pants. And so after the first tube, we were watching a funny movie, and I was like, oh, God, I got to make it to the bathroom, but I made it, and I made it just fine. And I went back downstairs, and I said, hey, that stuff is working. And they said, what are you talking about? And so we started, sharing stories about that with my friends, and they were talking about how they had been suffering with issues like that too, and they thought that the only thing they could do was, wear a pad or Depends, something like that. So I'm happy to report I've only taken one box, which to me I divided the doses up. And instead of 3 doses, I made it 6 doses every 3 days, and I've had no bladder problems since then. Everything that I experienced, that I achieved, has stayed. It's been probably 6 weeks since I finished, and everything, it's really remarkable, and it's made a huge change in my life because I'm not self-conscious about that anymore.
I can imagine that's a pretty big deal. Now, the VRS is not a treatment for, accidentally wetting your drawers, but it's, what it does is it helps to activate the stem cells and allows the body to do the healing. So, and your results may not be typical of everybody, but it's pretty encouraging when you hear something like this. My next guest is a very good friend of mine, Carolyn Kendall, and she's a nurse and has been for the more than 40 years. Her job is as an anesthetist is to put people to sleep and then wake them up again, which is a good thing. She's also a cancer survivor, and I think she's got an interesting story to tell, too. Carolyn, besides my persuasiveness, what made you decide to try VRS?
I wanted to get more experience with the products of WellMed, and I had been on the search for a long time for a better enhancement for my nutritional status. I'm an insulin-dependent diabetic and have been for years. I was adult onset. And with that said, I decided, I trusted Ken. And again, I told him, I said, whatever it is, send it to me. I'll let you know if it works.
Ken is my husband, by the way.
Oh, yeah. And, I don't like to hear all the rah-rah of any product line that is about, this is going to save you. This is the ultimate product. This is, everything you've ever wanted. So I just wanted a cold case. And so I took the products, and I really started feeling better. And so when I started on this VRS, and I've been on it for over a year, I was amazed at how much better my overall sense of well-being was. And I say over and over again, you don't know how sick you are until you start feeling better and realize that, there is sometimes a rainbow ahead of you. That said, the VRS was something that was very appealing on the outset because as not a hormone replacement, it was an enhancement. And, of course, that catches everybody's ear when they say that about vaginal products. And then when it said rejuvenation, I thought, what? How are we going to do that without hormones? I mean, I was raised with internal medicine, and, it just took me off guard very pleasantly. So I started taking it, and I did never wanting to hold back. I took a whole vial of it instead of splitting it in half because I didn't know any better. But I thought, well, it didn't hurt a thing. And I instantly remembered how I used to feel when I was 20. And, the mechanical end of it is it lubricates you. But, you, of course, put it in at night, and the next day I thought, wow, I really didn't know how much I was hurting because I was dry as a bone. I had ovarian cancer when I was 57 years old. Was not expected to live for 6 months, and I fooled them. And so here I am 10 years later, and there's no way. I started getting very dry. Of course, right after the surgery, I took my lone ovary out, and so there was no estrogen supply to speak of. And I started getting dry. I thought, okay, well, we'll just deal with this a little bit with some lubricants here and there. But after a while, I just got squeaky, and it was like, it hurts to walk. I was so dry. And the VRS changed that in 24 hours. And for anybody who's had cancer, especially breast and ovarian, where the estrogen receptors have to stay quiet, you can't have estrogen replacement. And the biggest replacement for vaginal dryness is doctors want to give you Premarin or any one of those estrogen-based creams, and those have their own side effects. You can read on it yourself. But the fact that this was a natural product that rejuvenated the tissue structure was what was so fascinating to me. And it's like, I can't believe there's finally a product for women that has no side effects except good ones. I've had a number of female surgeries, and it's interesting as you're rejuvenating. I don't know, I just get a picture in my mind that the scarring of the vaginal area because of childbirth, I had a rectocele, which means the vaginal wall was so weak that my bowel was pushing into my vagina. Had to have that repaired, several episiotomy repairs. And all that, actually leaves a lot of scar tissue that doesn't stretch or isn't as pliable as, a healthy tissue. And as those things were being rejuvenated, I got a pain feeling, and then it went away. It was like it was just pushing the scar out. I mean, that sounds silly, but I was having so much activity down there in repairing with the VRS that I kind of went through a healing period that was kind of strange. But it all resolved, and I feel so much better. I feel like I'm back in the human race.
Wow.
I recommend VRS for anybody who has had any kind of surgery where the ovaries are gone for one reason or another, whether it's polycystic kidneys, cancer, just a clean sweep with a hysterectomy. It puts you back in the womanhood slot like nothing else can. And when you feel better there, I don't know, several months ago, a lady was on one of our calls, and she said, that chakra needs some healing too.
Yeah,
and
right. You kind of go from feeling like a raisin to be feeling like a grape.
There you go, a juicy grape. Big old grape.
Well, thank you. Thank you, Carolyn.
You're welcome.
Next, my guest is Sherry Bergamo, who is also a nurse. She's a nurse practitioner, and she's been working helping women with symptoms of menopause for some years now. Now, Sherry, why did you decide to give VRS a try?
A friend of mine is a chiropractor, introduced me to WellMed and told me about vaginal rejuvenation system. And in working with menopausal gals for about 25 years now, one of the biggest reasons they come in is vaginal dryness. And some of them can't take hormones. The reports about VRS were really stellar, and I'm going, this can't be real. But I was very excited, so I said, well, I've got to try this myself. I had been using estrogen occasionally for dryness, and so I personally tried it and have used 2 boxes now. What it certainly stops the vaginal dryness, but what I've noticed is the nerve regeneration in the vagina and the return of feelings there that at 73 I'd forgotten I even had. And it's been absolutely amazing to me to I had forgotten that when young women get sexually excited in their heads, the vaginal area responds. And that happened, and it was like, what? So for me, in talking with my patients, not only is it vaginal dryness, but they haven't had interest in sex because of the dryness. And for relationships, that's an incredibly important part of a relationship with husbands and wives. Being able to restore relationships just with being able to have a great sexual experience is just beyond. And I don't mention estrogen much anymore at all to patients. First of all, the cost of estrogen vaginal cream is over the moon now. For some of the gals that have to pay for it, it's like almost $250 for a tube of estrogen vaginal cream that is not going to give them what VRS has given. So that not only are the tissues rejuvenated, but the nerve endings are. And they've all come back. And so these gals are kind of in a Twitter about all this, and it's been so exciting, I just can't tell you.
those estrogen creams aren't exactly good for the male portion of the couple either, are they?
Absolutely not.
Yeah.
Bad
enough for women. They're really bad for men. So
really, one of my patients was saying her husband, after having relations a few times with her estrogen vaginal cream, he's starting to cry and have all these emotional problems. And I said, oh, no. He was getting himself too much estrogen.
Yeah, I'm really grateful for all of your sharing, but I'd like to ask some questions now, and I open this to all of you, all three of you. So if you would make sure you're not on mute. How long do you suppose it would take for VRS to begin working?
I think that's an individually for every woman, and it can depend on their age and their circumstances. Young girls on the pill get very dry. I don't think it would take as long to restore that with them in a non-hormonal way as it would someone my age. So I got results after about 3 applications. I have some patients that it's taking them about 6 to really respond, but so I think it's different with the age of the woman.
And some symptoms might disappear faster, like, for example, the VRS acts as a wonderful lubricant very quickly, but there might still be some difficulty with intimacy with pain still. That may take a little longer, especially if there's any scar tissue or something like that. Would you say?
Yes, I would say. And they may need to use either an additional lubricant or even just a little bit of, if they have any, estrogen cream on the outside for a few times. Not during sex, but just to see if the outer lips get enough of the VRS, or if we should put some VRS on the outer lips as well. Make sure that area is getting it too for rejuvenation.
Mm-hmm. All right. How would VRS be helpful to women who aren't necessarily sexually active?
This is Darlene. I would say that regardless if they're active sexually or not, the discomfort from the dryness, there's women who make their living driving across town all day, maybe as salespeople or what have you, and just the discomfort alone of having to go through that, whether or not you have a partner, is really immaterial. I think that you start healing from the inside out.
Okay. Anybody want to make any comment about whether or not this is safe if it actually accidentally gets in the mouth? I know, that's a tough question. No, it's not dangerous to consume it in small quantities. Anyone want to field the question of how long they can use? How long can you use VRS? How frequently can you use it?
Hopefully forever.
Yeah, I would feel just get better and better and better.
Excellent. And how often a month do you just those of you on the call, how often a month would you say that you use it?
Every 3 days.
Every 3 days.
About every 3
days.
And you use what, about a half a tube?
Uh-huh.
Yeah.
And is this on a continuous basis, or would this be as required?
This is Carol. I can answer from my point.
Sure, that's what I'm looking for.
Yeah, I'm not a spring chicken, so I need some sort of a lubrication anyway. But because there was nothing, no lubricant, no Premarin, no nothing. I hate to say that term again, but for so long, it took a while for me to get up to what I would think was an acceptable level of comfort before, I could back off a little bit. Now, I have backed off a couple times and not used it for a few weeks just to see if it was real. And, much as I believed in it, I thought, is my body catching up or not? And it took a longer time for me to feel dry or, not well below the belt. And then I picked up on it again. And I think using it for me in a series of every 3 days and using half or a whole ampule at a time, doesn't matter. As long as you're getting something there, it seems to spread around enough to the tissues that it kind of goes where it's needed, kind of a leveling effect. And I continue using it, every 3 days. I think you're better off that way because, it's just feeding your tissue more. Mm-hmm. And I don't think the tissue is going to take more than it can handle because once your vaginal walls and, vaginal and all your tissues are rejuvenated, it's not going to get over-rejuvenated.
It's sort of like using the daily serum on your face. You use it every day
right.
because your skin cells are constantly regenerating.
Exactly.
Yeah. Well, one thing is for certain healthy tissue keeps the whole body healthier. So if you can keep the vaginal tissue healthy, it improves your chances of keeping the whole body healthy.
Mm-hmm.
It's like you don't want cuts or abrasions on your skin because that opens you up to more infection. Same thing with the vaginal walls. It keeps when it's healthy and plump, then the system stays healthier. Well, I'm looking at our time here. I think what I'd like to do now is take it off record, and we'll see if anybody has any questions that you'd like to *6 and get on the call and ask your questions.
This is Tina, and I'd like to just chime in a little bit. One of the things that's very important about VRS is that it's also been proven to change the pH of the tissue. And so when we balance the pH out of the vaginal tissue, now we're looking at also, less infection, yeast infections and those types of things as well. Thank you.
We're going to end the recording now.